Good evening, folks. Now, discussion E is also a bonus one. The subject is overview of the transition from school-based OT to adult or geriatric practice. The surrounding page positions this transition as both a professional transition, as both professional evolution and a response to pressing social needs, societal needs for occupational therapists, OTs, accustomed to the rhythms of school-based practice, moving into adult or geriatric care offers a chance to expand their scope, deepen their clinical reasoning, and engage with populations whose needs are rapidly growing. With the aging of the population and the rising prevalence of chronic conditions, the page underscores that adult and geriatric practice is not only rewarding, but also strategically important for the profession's future. Why OTs make this shift? Burnout with school rhythms. School-based OTs often feel limited by rigid schedules, repetitive caseloads, and documentation tied to individualized education programs, IEPs. The desire for new challenges and more diverse clinical outcomes drives many toward adult practice. Population level demand. The demographic shift toward an older population creates abundant opportunities in hospitals, skilled nursing facilities, home health, and outpatient clinics. OTs are increasingly needed to address chronic illness, fall prevention, and functional independence. Professional growth and impact. Adult practice allows OTs to engage with complex medical conditions, collaborate across disciplinaries, and influence outcomes that directly affect quality of life, such as safe discharge, community. Reintegration, and caregiver support. How pediatric OT translates to adult practice. Functional analysis, skills in breaking down tasks and adapting environments for children apply seamlessly to adult ADLs, activities of daily living, and IADLs, instrumental activities of daily living, such as bathing, cooking, or medication management, family systems, and education, experience coaching parents and teachers becomes invaluable when guiding spouses, adult children, or caregivers in home health and long-term care. Sensory and regulation strategies. Techniques used for sensory processing in children can be adapted for adults managing fatigue, anxiety, or neurological conditions. Mindset shift. Instead of focusing on school participation goals, OTs pivot toward outcomes like fall prevention, functional cognition. Safe discharge planning and community participation. Practical steps to transition, skill bridging, refreshing knowledge in adult uh, philosophy, um, cardiopulmonology, and neurological muscular skeletal. Pursue continuing education in functional cognition, adaptive equipment, and home modifications. Seek mentorship or structured onboarding programs. Often, available in skilled nursing facilities or hospital systems. Entry settings. Skilled nursing facility and subacute sub, subacute rehab, high demand, strong membership, and measurable functional process. Home health emphasizes safety, caregiving training, and real-world habit formation. Outpatient and acute care offers diagnosis, specific pathways, orthopedic, neurological, cardiac, and interdisciplinary collaboration. Portfolio alignment. Tailor resumes to highlight adult outcomes, fall prevention, equipment training, functional cognition, and emphasize interdisciplinary teamwork. Common fears and how this page addresses them. I've only done pediatrics. The page reassumes that core OT, reasoning, and occupation-centered practice are transferable. Targeted CEUs and supportive teams help bridge gaps quickly. Documentation differences. School-based OTs accustomed to IEPs must adapt to medically oriented documentation, focusing on functional change, safety, and discharge planning. Risk of transition. Rising demand and mentorship rich roles reintroduce the risk of entering adult practice, making the shift more accessible than any expect. Broader contexts and opportunities for impact. This transition aligns with national priorities around disability, aging, and continuity of care. OTs who understand school-based transition planning can extend their expertise into adulthood, ensuring smoother pathways for individuals across the lifespan. Adult practice also allows OTs to address social determinants of health, environmental barriers, and caregiver capacity, critical factors in sustainable functional gains. In this way, the move from pediatrics to geriatrics is not just a career change, but a contribution to systematic healthcare reform and equity. Takeaways. Motivation, greater autonomy, complexity, and impact in higher demand field. Action, bridge medical knowledge with CEUs and members and mentorships. Select entry settings that match your learning curve. Confidence, pediatric skills are deeply transferable. Reframe them toward adult goals, safety, and independence. This transition is framed not as leaving one population behind, but as extending the OT's reach across the lifespan, ensuring that the same principles of meaningful occupation and functional independence guide care from childhood through older adulthood. Okay, guys, that's it for tonight. See everybody tomorrow for shows. For now, Gator Wellness. Take care, folks.